Hey guys, have you been dealing with shoulder pain for a few months or even a few years? Have you tried physical therapy? Have you tried injections? Have you tried rest and it hasn't gotten better? Hey, I want to talk about today why your shoulder pain isn't getting better, and more importantly, how shockwave therapy and EMTT combined with physical therapy can get you back to doing the things that you love, like working out, lifting, or even as simple daily tasks as sleeping at night. So first, let's kind of go over why your shoulder pain is still there. Your shoulder, first of all, is made up of about 16 muscles that all work together to keep this ball in the socket. And when your shoulder is hurt or when you've injured it, these rotator cuff muscles typically tense up and don't activate well. And when they don't activate well, it doesn't keep the ball in the socket and you don't get fluid movement. So typically when most people rest, the true issue isn't corrected. Rest calms inflammation down, but once you go back to lifting, it just gets all aggravated because the rotator cuff wasn't activated or loosened up enough. And then injections are great when your pain's super high and inflamed to calm it down. But again, it doesn't get down to the root cause of the issue, whether it's your rotator cuff or your mid-back. And that's why shockwave therapy is something that we use in the clinic a lot. Shockwave therapy is a form of acoustic pressure waves that cause micro trauma down at the tissue. So we use shockwave at your rotator cuff to cause micro trauma to increase blood flow to that region and cause increased healing. So think of it as working out. When we work out and lift heavy weights, we're causing micro tears at our muscle, in our muscle fibers, which causes increased blood flow. It causes your body to heal those tissues better. And that's what shockwave therapy does. It gets about 2 inches deep down into the tissue to be able to cause those micro tears. Along with shockwave therapy, we use EMTT. Sometimes people come in, they're super flared up. This is too aggressive. So EMTT is a form of magnetic pulses that work deep into the tissue, about 7 inches deep into the tissue to promote healing, but most importantly, helps calm that pain down. It helps decrease swelling at that site and helps us get back to doing some of the strength stuff that we need to do in PT. So this helps calm pain down, increase healing so that we can get back to strength training and working out, which is what ultimately is going to get you back to lifting. So when we use shockwave therapy and EMTT together, combined with physical therapy, we found that people heal about 50% quicker and they're able to get back to doing the things that they love. They're able to get back to strength training quicker and get back to even just sleeping at night more comfortably. So if you've been dealing with shoulder pain and want to know if shockwave therapy and EMTT will be appropriate for your case, the first step is to give us a call and schedule that initial evaluation. Because for some cases, there's no benefit, but for most, this is ultimately game changing. So if that's you and you want to give us a call, the number is below. Feel free to give us a call and we're looking forward to hearing from you.